Hey there, you dealing with lower back pain and you think that you might have degenerative disc disease? Have you had an MRI or an X-ray and a physician told you based on those results that you have degenerative disc disease? Well, most people don't get a full explanation on exactly what this is and what to do about it. And through this video today, I'm going to tell you exactly that information. I'm Dr. David Midoff. I'm a specialist physical therapist over at Paso Physical Therapy, and I've been helping out people with lower back pain problems, specifically with degenerative disc disease, for years. The cool thing about this problem is that it can get better naturally without having to rely on medications, injections, or surgery, and we help people do this all the time. Now, there's a lot of facets to a degenerative disc disease problem. It's kind of an accumulation of several different little causes that all come together to form degenerative disc disease. So I'm going to go through all that with you so that you can have a better understanding of what it is and what to do about it. So first off, let me tell you about the signs and symptoms of this. That way you can see if this is what you've got or not. And most people with degenerative disc disease are 50 and up. It tends to affect people later in life, and it's a combination of arthritis, bone spurs, disc problems, shrinking disc height, and pinched nerves all coming together at the same time. Now, the process of accumulating all these problems happens gradually over time, so it's not like it all happens all of a sudden. It's slowly over years, and that's why this tends to affect people later in life. One of the biggest complaints of this is back pain. Stiffness, especially in the morning when waking up, stiffness with getting up and moving around. It commonly takes people 20 minutes, 30 minutes, sometimes even up to 60 minutes of time to free the back up and kind of get to a working place where it's not that bad and they can move around. Oftentimes the back pain gets worse whenever they're lifting something heavy or carrying something for a long period of time. Even just standing for long periods of time can affect the problem and make it worse. Many times people with degenerative disc disease get the sensation where their back gives out, where they just all of a sudden get a bunch of back pain and are kind of out of commission for at least a few hours, sometimes as long as a few days. In worst cases, it can take weeks or even months to get better from a flare-up like that. They would have overdone it somehow. Typically, they would have walked too much or stood too much or picked up some heavy stuff. Oftentimes when we get patients here in the clinic, they're doing housework and they just overdid it, or they went on a trip and were on their feet too much. And when they return back from their trip or finished with their housework, their yard work, then they paid for it, is what they often say. I knew I was going to do all that stuff and I knew I was going to pay for it the next day. But as the degenerative disc disease gets worse, the length of time of the flare-ups tends to get longer and longer and longer. Usually when they're in their 50s, they say, well, you know what, I can deal with the flare-up. It lasts just a day or two. I take some pain medication and I'm good. I can get on with my life. There's always that low level of back pain, but nothing that stops me from being able to work and take care of my home and my family and do everything that I need to do. But as the years go by, it worsens and worsens, and what was a 1 or 2 day flare-up now turns into a 5 to 7 day flare-up. And they're out for a while. They are moving a lot less. They're usually getting less healthy on other fronts because they can't exercise as much as they like to. They can't walk as much as they like to. They're just not as active as they were in younger years because the back pain is just debilitating them slowly over time. And if this gets bad enough and goes on long enough, people often experience losses of balance. They begin to feel like they need to hold on to walls to walk around, or furniture, or people. They need to grab a hold of somebody's arm just to make sure that their balance is okay. And this tends to happen because if the problem is there long enough, it can begin to affect the nerves that come out of the low back that go into the legs and provide the nerve supply to the muscles of the legs. It also helps with the balance systems within the legs. So if that begins to get affected over time, then you start to have some balance issues, and that sets you up for some other potential problems, falls, fractures, those kinds of things. Now, people that go get x-rays or MRIs, other imaging studies, are often told that they have decreased disc height. The discs that are between the bones of the spine are shorter than they should be. They also find bone spurs on the vertebrae, on the bones in the spine, and they'll often find disc herniations as well. There's parts of the disc that might be bulging out, and oftentimes there might be stenosis as well. Stenosis is where there's narrowing of the spaces for the nerves to travel through the spine, and sometimes they'll say that they've got a pinched nerve sensation. And sometimes off the imaging, they'll tell the patient that they've got a pinched nerve in an area of the spine. And the patients often feel it. They'll feel that back pain or that radiating pain. Oftentimes it can feel like sciatica, where there's pain going down the leg from the back. In rare cases, there isn't much back pain, maybe a low level of it, but the pain going down into the legs is much more severe and stops the people from being able to do what they want to do. But when they do the imaging studies on their lower back, they'll find that they've got this degenerative disc disease like we're talking about. Some other findings that will be on the imaging will be arthritis, osteoarthritis, and then they'll talk about facet arthropathy, which just means the facets are some joints within the spines. So arthropathy, arth means joint, pathy means disease. So there's some joint disease in the facets. It's usually arthritis that they're talking about. If you have had an x-ray or an MRI that talks about all this stuff that I'm discussing, it can be overwhelming and you hear all these big medical terms. I wouldn't get too concerned about it. It's just a lot of medical jargon. The reality is we've had people in here that have some terrible looking MRIs and x-rays, and through our treatments here as specialists, we can actually get them to balance better, to walk better, to have less back pain, and be able to live a life without constantly worrying or thinking or stopping or adjusting their schedule to their back problem. So we help people do that all the time, even with severe degenerative disc disease. Now, the most common treatments that people with degenerative disc disease are recommended is, of course, pain medications. They'll start some sort of oral pain medication. They might also do injections where they stick pain medication into the spine using a needle. And then in some cases, doctors might recommend surgery to open up holes for nerves and put space in more discs. They can replace discs now these days, so they'll look to do that. And the surgery is dependent on age and strength and other health factors that the surgeons have to take into consideration. But what you have to realize with surgery is once they go in and do that, they can't really undo it, and there's risks with surgeries. Infection, the surgery not even working. Oftentimes with degenerative disc disease, there's so many components to this, like I described, that when a surgeon goes in, they're fixing one of those components usually, maybe two if they can wing it. But to fix the arthritis, the disc problem, the pinched nerve, the stenosis, all these issues that I talked about, it's really challenging to fix with surgery. And so the other recommendations that are out there are weight loss. Sometimes if the person, the individual dealing with a disc problem is a little bigger and can stand to lose some weight, that can help. Oftentimes it does help to some degree, but what needs to be addressed even in people that are heavier is the strength. Because we get people in here all the time that are not obese, they're not heavy, they really don't need to lose any weight, but they're still dealing with a degenerative disc problem. And what we find the root is oftentimes is a muscle imbalance, the way that they're moving, some strength issue, some joint that's stuck, some muscles that are stuck as well. And that's something that needs to be checked hands-on in the clinic and talked about with the patient, and a plan needs to be formed so that we can have a process to fix this degenerative disc problem gradually over time for the long term. That's exactly what we do here at El Paso Manual Physical Therapy. Hey guys, if you thought this video was helpful for you, please give us a like. And if you want to get notified about more helpful tips for your health, hit the subscribe button so that we can notify you every time we release a new video that could help you out in your health journey. And if you're looking for more specific videos on lower back problems, head over to the home page for our YouTube channel. Just hit the logo and then go down the page and find the playlist for back pain help. You'll find tons of exercises and other helpful videos to help you out for your specific back problem. I hope that you have a great day. Bye-bye.